everyone, and welcome back to Nurses Lecture Room YouTube channel. My name is Messi Mary, popularly known as the Nurse with the Difference, and I make learning easy and accessible for students. Today we're going to be talking about vital signs. What are vital signs? What are the components of vital signs? Do we just have 4 vital signs, or there are more than just the blood pressure, the pulse rate, the respiration rate, and also the temperature? What happens when these vital signs are abnormal? By the end of this class, you'll be able to answer all these questions correctly. But before we go into details, kindly click on the subscribe button, turn on the notification button so you don't miss out. Let's go there. Alright, welcome back. Like I earlier said, today we're going to be talking about the vital signs. What are the vital signs? Vital signs are cardinal parameters used to assess body's most basic function. They are cardinal parameters, they are important parameters, they are necessary parameters used to assess what? Used to assess body's most basic function. I know most of the students listening to this voice note, they can check the temperature, they can check the pulse rate, they can also check the respiration rate and all those things. But whenever they are asked to define it, to say a lot of things about it, they get stuck in a radar and don't know how to really arrange those words. So there are basically 4 major components of the vital signs, but the remaining 2 will be discussed at the end of this class. But the first we have here on the board is the body temperature. The body temperature, in a layman's language, the temperature is the measure of the degree of hotness or coldness of the body. But the temperature usually varies. It could be that stress can actually change it, exercise can change your body temperature, disease and infection can change your body temperature. As a woman, during your ovulation period, your temperature changes. So there's going to be a lot of things that alters the temperature of the human body. But the normal temperature range is between 36.2 to 37.2. The normal temperature rate is between 36.2 to 37.2. When you're having an increase in body temperature, when you start getting 38.2, 37.9, 38 degrees Celsius, we say that this patient is having what? Hyperthermia. Hyperthermia. But when there is a reduced body temperature below 36.2, you're having 35.2, you're having lesser than, you say this patient is having what? Hypothermia. So that's the difference between what? Hyperthermia and hypothermia. Hyperthermia is increase in the body temperature, while hypothermia is a reduction in the normal body temperature. Your body temperature can be taken orally with your mouth, that's beneath the tongue. It's going to be taken rectally through the rectum, then also axillary, the popular one we see in the axillary region. So these 3 are the common ways in which we can take our body temperature easily. Then the second component of the vital sign is the pulse rate. The pulse rate. What is pulse rate? The pulse of a human body is a measurement of the heart rate, or the number of times the heart beats. The pulse of a human body is a measurement of the heart rate, or the number of times the heart beats. The normal range is between 60 to 100 beats per minute. If it is above 100 beats per minute, that is when we start talking about tachycardia. Tachycardia. When the pulse is above what? 100. When it is lesser than 60, we start talking about bradycardia. We can say the patient is having bradycardia. We can also say the patient is having tachycardia when it's above. But one thing you have to take note of as a nurse is not just to go to the patient's radial artery to check. You have to check for the rhythm. You have to check, oh, is it frequent? You have to check the rhythm of the pulse rate. You have to check how it is. If it is slow, if it is very, very fast, if it is fluctuating, you have to check the intensity. You have to check all this while assessing the pulse rate of your patient. And the pulse rate can be taken from your temporal artery, your facial artery, carotid artery, brachial artery, radial artery, femoral artery, popliteal artery, posterior tibial artery, and the dorsalis pedis artery. The picture showing on the screen kindly help you explain where these arteries are located in the body. But the common one we usually use in a hospital setting is usually the radial artery and sometimes the carotid artery. Then that takes us to the next component of the vital sign, which is the respiratory rate. The respiratory rate. The respiratory rate is the number of breaths a person takes per minute. The number of breaths a person takes per minute. Your respiratory rate is calculated: breathe in, out, 1, up, down, 2, up, down. You calculate for a minute. So your respiratory rate is what? The breath a person takes per minute. The normal respiratory rate is between 12 to 20 breaths per minute in an adult. But when you start having 22, 24, 26, there's a sign that there's what? Tachypnea. That's increase in the respiratory rate. But a reduction in the normal respiratory rate below 12, we say that bradypnea has taken place. Remember, for pulse, increase is what? Tachycardia, and reduced is what? Bradycardia. While for respiratory, high is what? Tachypnea, and low is what? Bradypnea. Then that takes us to the fourth one, which is blood pressure. Blood pressure is the force pushing against the artery wall. The blood pressure is the force pushing against the artery wall. For example, take a pipe. You see water going through it. The force applied by this water on the pipe is the water pressure. So the force applied by our own blood on the blood vessels is what? The blood pressure. The normal blood pressure, according to WHO, is between 120 to 140 milligram mercury for the systolic value, that's the up, while the bottom, which is the diastolic, you're having like 70 to 90 milligram mercury. But when it is above 40, we say it's hypertension. But when it is below the normal range, it is what? Hypotension. But one thing you should know in the definition of hypertension is that hypertension has to be consistent and persistent over a period of time before you say a patient is hypertensive. A patient don't just walk into the hospital setting and you check the vital signs once and you jump into conclusion that this patient is hypertensive. It has to be persistent, it has to be consistent. That's this over 140-90 milligram mercury before you say, oh, my patient is what? Hypertensive. So those are the 4 major components of the vital signs. But other vital signs include pain, your oxygen saturation level, and also your capillary filling time. So in terms of oxygen saturation level, you take the oxygen saturation level of a person using the SpO2 machine, the pulse oximeter. Then you can assess the level of pain using the pain scale, your pain rating scale. With that, you will be able to know what is going on with the patient. I hope this video actually helped you to understand the various components of the vital signs. But before I conclude, for student nurses, before you go into before you carry out the procedure, assess the vital signs of a patient, you have to ensure that your instrument is available. Your sphygmomanometer, your stethoscope, your thermometer, your gallipot, with a swab on it, both wet and dry, to clean the thermometer. It has to be there. Then you also have to have your watch. It could be your breast watch or your wristwatch. All these things have to be in the tray when going to your patient's bedside. If you are also going to be taking the pulse, the oxygen saturation, you have to take your pulse oximeter alongside. Thank you very much for staying tuned. Thank you very much for watching our video. Don't forget to like, don't forget to comment, don't forget to click on the subscribe button, don't forget to share with a friend if you got value. See you in our next video. Bye.